Good afternoon. I'm Laura Biscotte, a pediatric nurse practitioner, and presenting with me is Dr. Amanda Tiffany. Neither of us has any disclosures. Dr. Tiffany and I both work at Carilion Pediatric Medicine in Daleville. We each have 2 children, and we were fortunate to be able to breastfeed through the first year of each of their lives. Additionally, we took a 10 to 12 week maternity leave with each of these babies and continued to pump and breastfeed after returning to work. We personally know the joys, the struggles, and the health benefits of breastfeeding. Briefly stated, breast milk is the optimal source of nutrition for most infants. For various reasons, this may not work out for all families, but when it does, the benefits are significant. Exclusive breastfeeding is recommended by the AAP and the CDC for the first 6 months of an infant's life. Then at 6 months of age, adding solid foods while continuing to breastfeed through at least the first year of life. Breast milk is easier to digest than formula, and most importantly, it provides natural antibodies that boost the immune system. Breastfeeding provides benefits not only to the infant, but also to the breastfeeding mother. Breast milk is quite remarkable. It is living biologic nutrition. It contains macro and micronutrients, living cells, growth factors, and immunoprotective substances. As you can see listed, the makeup of breast milk is extraordinary. It is composed of components that have antimicrobial activities that aid in prevention of infection and maintaining health. It has immunomodulatory agents that keeps the infant's immune system strong, and additional factors that promote gastrointestinal health, creating an optimal gut microbiome. As you likely know, the gut microbiome influences immunological, endocrine, and neural pathways that play an important role in infant development. There are many short-term benefits for breastfed infants. Breast milk has great benefits for the GI system, as discussed previously, reducing the risk of gastroenteritis and diarrheal disease. Breast milk also increases rates of gastric emptying, thus reducing constipation and gastroesophageal reflux. Breast milk helps prevent other non-GI illnesses, including respiratory illness, otitis media, urinary tract infections, sepsis, and reduced rates of sudden infant death syndrome. Breastfed babies have neurobehavioral benefits as well. They tend to be less fussy than formula-fed babies, as there is more skin-to-skin contact and there is a reduced amount of crying and decreased infant stress. Breastfeeding increases glucose levels and cardiorespiratory stability. Breast milk can provide benefits long after the first 1 to 2 years of life. Breastfed infants continue to have a reduced rate of pneumonia, otitis media, and upper respiratory infections. There is less type 1 diabetes, inflammatory bowel disease, asthma, and improved dental health. Less prominent benefits include less incidence of obesity, allergies, leukemia, type 2 diabetes, and celiac disease. It is also suggested that there's improved cognitive development, hearing and vision, as well as less ADHD and autism spectrum disorder in breastfed individuals. Not only does breastfeeding benefit the child, but there are significant benefits to the breastfeeding mother. Reduced rates of breast cancer, diabetes, heart disease, osteoporosis, ovarian cancer, depression, endometriosis, and some autoimmune diseases, to name a few. So as medical personnel, not only do we have a responsibility to educate families of the benefits of breastfeeding, but also provide support to help with their success. Breastfeeding is hard work, and Dr. Tiffany will discuss this further. The sooner mom's milk supply comes in, the more likely there is for success. This means nursing as soon after delivery as possible and continue with frequent feedings in the hospital, ideally nursing every 2 to 3 hours, which often means waking a sleeping baby. If a newborn is not nursing well, then a mom should be pumping at that interval to stimulate milk production. Milk production is largely related to demand. So if a newborn or a pump is not demanding the milk, then a mom's body is not going to supply it. Hospital staff can be very important in aiding with feeding and encouraging frequency. Low milk supply and delayed milk production are 2 reasons breastfeeding might fail. A crying, hungry baby or a baby not gaining weight well contribute to breastfeeding barriers. Once a baby is discharged, they should have close outpatient follow-up, generally within 2 to 3 days. Not only does this help to ensure the baby is hydrated and healthy, but also to help answer questions and troubleshoot as needed. First-time breastfeeding families tend to have many questions, and a pediatric office can be of great help. Be realistic with expectations. Expect the breastfeeding mother to have pain for several days, as this tender skin is suddenly being chafed for 20 or more minutes every 2 to 3 hours. Discuss that engorgement is brief, lasting only a few days. Prepare them for fatigue and lack of sleep. Additionally, postpartum hormones are intense, specifically in the first 7 to 10 days after delivery. All babies lose weight, and managing weight loss appropriately is important. Often, if newborn weight loss is less than 10%, then no intervention is needed. If weight loss is 10 to 15%, then supplementing a small amount of formula, such as 15 to 30 milliliters of pumped milk after every feed or every other feed, is often adequate until a mom's milk supply has come in. Then discontinuing is able. If an infant has lost over 15%, then hospitalization may need to be considered due to dehydration. Most importantly, support is critical, assisting with the goals and needs of the unique family as a top priority.
And I'm going to kind of pick up where Laura's leaving off, which is that medical personnel role. So I'm going to be speaking to both of my own experiences with my 2 young sons, most of whom, you know, Patrick is now 3.5, and I nursed him up until about 26 months. And our newest addition, Connor, who is now 11 months old and still going quite strong with nursing. As a medical provider, seeing newborns and moms very early on in their journeys, I think is important that we address some of the myths that surround breastfeeding. We all know the saying that breast is best, and while, like Laura mentioned, breast milk is optimal, in most situations I feel that this statement is made in a way that makes a mom feel like if she's unable to breastfeed, then that is clearly she's not doing what's best for her child. I think this statement and this mentality can be very disheartening to moms, especially those who are already struggling, and completely detrimental to some who are struggling with their mental health in the postpartum period. In my experience, most moms benefit from hearing that however their child gets fed and that their child is growing and developing normally is the mom doing what's very best for her child. And if that means in the early days they need to supplement with either express breast milk or formula, that's fine. If that means they need to do a combination of pumping and nursing, that's also fine. And if it means that they nurse their baby for 3 days, 3 weeks, or 3 years, that's also fine. Each individual parent, child, and then infant is going to determine what's best for them. Oftentimes there is this idea that if a baby is crying, then they must be hungry. And while if you ask my husband, that was definitely always my default answer when babies are little, that isn't the only reason why babies cry. We know that babies cry a lot, and sometimes for no reason at all. So in allowing parents to know that yes, if their baby cries and you try to feed them, even if after attempting to feed them, if they continue to cry, it doesn't necessarily mean that they are hungry. Now, of course, offering nutrition in appropriate amounts at appropriate times is what we all know to be best, but there are other ways to soothe babies, and knowing that as a first-time parent is very beneficial. Most of us have heard of either the 5 or 6 S's, depending on how many you use, including sucking, swaddling, shushing, swinging, being on their stomach, and all of these are different ideas that parents can try once they've fed their babies to continue to make them happy, which will help them stop crying as well. Now, I may very well get myself into trouble here, but I think it's important for parents to hear that while, yes, we prefer to stave off the use of passies and bottles in the early stages until a good established breastfeeding match is made, there are times where that idea or that mentality has to be abandoned. In the beginning, if mom is uncomfortable, as Laura mentioned, having difficulty with latch or engorgement, difficult with either the onset of letdown or perhaps a too forceful letdown, then sometimes bottles and pumping are of a necessity. And that does not mean that the mom and the baby cannot go back to successfully breastfeeding. It just means that in the short term, there's going to be something what we need to use in order to put it in place until they are successfully able to breastfeed later. in the newborn phase, there are so many things that new moms need to know. And I certainly have an example of my story guidance on the next one. At the bottom, just because breastfeeding is natural does not mean it's easy. Breastfeeding, as Laura mentioned, kind of is a full-time job. I would personally say that my kids nursed what felt like every hour on the hour, like the weather. And I oftentimes use that example with parents in the room, because they need to understand that this is going to be something that requires a lot of time, energy, although it is extremely rewarding when it goes well. So on the right of the screen, you'll see kind of what my anticipatory guidance is for parents when they come for both that newborn visit, and oftentimes I'll give it to them again at their 2-week visit. The top right, the 3 keys there that I have listed are actually 3 of the keys that I learned from my Carilion breastfeeding class pre-COVID when we were doing them in the hospital. They've been something that stayed with me since I had that class, and something, interestingly enough, that my husband also said that he found to be really helpful in helping me succeed through my breastfeeding journeys. When it comes to breastfeeding, having the baby be as close to mom as possible in that either belly to belly or chest to chest format, that is going to allow for the child's natural positioning of their head, neck, face, mouth, tongue, as well as upper palate be in the correct orientation versus trying to feed a child with their head turned to one side or the other. Kind of using that nipple as a guide for the infant, especially in those early days, nose or upper lip, because as we're aware, the suck reflex is activated by hitting that upper palate and is going to make them be more easily able to latch. And then a wide open mouth. I used to laugh at this, but whether they were crying or yawning or screaming at me, that was often what I was waiting for, because a wide open mouth is going to make it significantly easier to get a deeper latch. And these are all clearly important in those newborn phases. And as we get later in and deeper into the breastfeeding journey, these things change. Laura's already mentioned nursing at the breast every 2 to 3 hours, but really also helping parents and families understand that that means from the beginning of one feed to the beginning of the next feed. So start to start is often what I'll say, because if you start breastfeeding at 10 o'clock and your baby nurses until 10:45, well, then I don't want you waiting until 1:45 or 2 o'clock to try to feed your child again. Much more likely that baby is going to need to eat somewhere between 12 and 1 o'clock. And then not allowing them to use more calories than they're earning. 30 to 45 minutes per feed is more than sufficient. And if they go past that 45-minute mark, oftentimes what we find is that they're actually burning more calories than they're taking in. Ideally, you do want moms to alternate their starting breast just to continue to even out that breast milk production, and trying to feed on both sides at each nursing session is ideal. Although I'll mention this in a little while, that's not always an option. Certainly, if they nurse and then become sleepy, burping in between or changing in between can be a mechanism that you use, or that parents will use, in order to wake an infant up, in order to hopefully stimulate their desire to eat more on the other side. Express breast milk, if it's available, or formula, as Laura mentioned, can be used for supplementation, especially in those early days when that weight loss is maybe just there at that 11 or just at that 12%. And while you think that they're just waiting for mom's milk to really come in, or getting an established latch, that's going to help, especially if they're still actively rooting or appear truly hungry after nursing. And then again, small amounts, 15, 20, maybe upwards of an ounce, especially in those early days. Moms should try to pump at least a couple times a day. I wish I had known that, especially with my first son. I do feel like it would have been significantly helpful when it came to the engorgement phase of breastfeeding. It was one of those moments where I was told, don't pump at all, because you're going to make the supply more than it needs to be. But certainly if the child is not nursing well, or mom doesn't feel like they're truly being emptied, then pumping, even just until they're comfortable. I try to, really empower moms to hear me say, you don't need to do this for any set period of time. You simply need to do it until you're comfortable. If you're feeling more comfortable, then you can stop. And whether that's after 2 or 3 minutes and just that initial letdown is out, or if it's another 5 or 6 minutes because maybe you're an overproducer, then that's going to be more comfortable for moms. Nursing every 3 to 4 hours overnight, at least. I recommend waking them up and not letting them sleep more than 4 hours at night until they're over birth weight. Most of the time for breastfed babies, that's by about 2 weeks of age. I like to see them back to their birth weight. Formula fed babies very often are back to their birth weight much faster, in and around a week. For moms, comfort is huge. And the tricks and trades that you learn along the way, I try to impart to parents when they're here in the office, using any kind of cream or ointment to keep the nipples covered, especially when an infant is not latching, as Laura mentioned, with the chafing, and maybe, the breast simply providing another, a resource that they've never done before. This is something that your body is going to have to adjust to. And so a lot of people know about lanolin, again, not necessarily recommending that that's the only one people use, but that is one that a lot of people talk about. But there are multiples over the counters, things you can, of course, order offline. Any of those are going to be useful, and giving the parents the recommendation, use this every time your child is done nursing. And then, before your child gets ready to start to nurse at the next time, you can use a little, soft, gentle washcloth with just some regular soap and water to take that off before the child nurses at the next visit or at the next nursing session. The goal really is at least, sometimes 8, sometimes 10, upwards of 12 nursing sessions per day, because if you think about it in that 24-hour period, if they're nursing every 2 hours, that's about 12 times a day. And you would hope that for the parent's sake that there is some stretches in there that are 3 to 4 hours, but not always. Breast milk production, I think, is so it seems like a mystery to parents sometimes, especially to moms, just not feeling like they don't have enough milk, or that they're not doing the right things. And so I highly recommend that moms drink upwards of 2, 3, even 4 liters of water or other electrolyte solutions throughout the day. And then making sure that moms are eating every time their infants are eating something small. A lot of times post-delivery, the appetite's not really back there. It hasn't come back. You're healing, whether it's from C-section or from a vaginal delivery. Certainly making sure that you're giving your body enough nutrition in order to supply that breast milk for your infant is important. But again, I think that's something moms need to hear. Otherwise, they often think, okay, as long as I'm taking care of them, I don't necessarily have to be taking care of me. And so having a support person who helps them do that is ideal as well. I know my husband knew that his job was, if I was feeding the baby, then he needed to bring me some extra water and a snack to make sure that I was also taking care of me as well. In the newborn phase, which we've just talked about, there's a lot. And so then I'm going to touch a little bit on what Laura mentioned with starting solids. That's a major conversation starter, sometimes even a controversial conversation. I usually do discuss with parents, because most people are really excited about the idea of starting some type of solid at 4 months. I talk about readiness. Is your child ready? Have they lost their tongue thrust? Do they have good head control? Can they sit in, with some support in their high chair? And if so, if they're still interested in starting some rice cereal or baby oatmeal, that's not necessarily going to be detrimental at 4 months of age, but it also just may not go well. So I talk a lot about that with parents, and that you might be pushing your baby a little faster than they're ready. It should not affect breastfeeding as far as that's concerned, because again, as Laura has already mentioned, the breast milk is still going to be that main source of nutrition till much, much closer to 9 to 12 months. And at that point, I usually recommend also, when I'm thinking about starting solids, to always nurse first, and then that solids take kind of a backseat or a secondary component to their nutrition. Because starting solids is important. They need to learn a new skill. They need to have something that isn't liquid in their mouth from a texture standpoint. We know that infants who wait too long to have solids introduced can have some feeding and some oral aversion for that very reason. So there are positives, and I talk about starting solids like I talk about any developmental milestone, which is it's going to take some time to learn how to do this, but nursing is still, or bottle feeding if you're pumping away from them at work. Night weaning is an interesting statement. So when it comes to night weaning, many families do this differently, and I think it's our job, and it's important for us as providers to support them in whatever path that they've chosen, as long as it's safe. Certainly by the time of 6 months, some babies have the ability to sleep through the night. However, personally, I have found that neither one of my breastfed babies slept through the night at 6 months. And therefore I thought I was doing something wrong. I thought for sure I must be missing something. There's a lot of stigma attached to does your baby sleep through the night? And I think for moms who breastfeed, they feel as though they need to do some specific sleep training or something that's more structured to kind of force their child into this pattern. I try to remind parents that, again, when your child is developmentally ready and when their desire to sleep outweighs their desire to eat, then they will sleep through the night. There are certainly stories that people will talk about, well, I put my child in their room and they cried until they went to sleep and then they never had a problem again. But I feel like that's not most infants, especially at 6 months. And it's not a hard and fast rule either. Just like we know children all babble and talk at different ages, they all crawl and walk at different ages. Falling asleep and being able to stay asleep and not wake up to nurse overnight is something that's going to happen at a predetermined time for that individual. At the bottom, I also have pumping, which Laura mentioned kind of briefly. Pumping with returning to work. This is something that I feel like moms really don't get unless you have a friend who's breastfed or you know someone who's a lactation consultant. You go into this very blind as far as not knowing what to expect or what the schedule might be. And so I try, especially at that 2-month visit when some of my moms are getting ready to go back to work at 12 months, to talk a little bit about pumping, to ask them, do you have somewhere that you can pump at work? Do you have a pump that you have available to you, either through your insurance or one that you've purchased at home? There are lots of new and interesting and very impressive wearable pumps that I am interested in maybe for the next one. I'm not making any kind of announcements, but for the next child, that would be a very interesting thing that you can continue to wear them while you're doing your job. But making sure that parents understand, like, mom, get your pump out, look at all your parts, make sure that everything is assembled correctly. How do you wash everything? Can you store them differently? What do you need to take with you to work? Can I keep my milk in a freezer bag? Do I have to have a refrigerator? Do I have to wash my pump parts every single time I use them? The answer is no. Put them in the refrigerator, keep them somewhere cool, and then wash them at the end of the day. So I think that's huge for us. And unless you have that information, it's hard to broach that conversation with a mom who's returning to work. Here I have listed out, because I know we're getting close, a few of the struggles that moms can deal with when it comes to breastfeeding. And really, these are kind of centered around a couple of different ideas. Latch certainly being a major concern, especially early on. And if you have a baby who has a small mouth or is potentially maybe premature with a weak suck, that can make breastfeeding quite difficult. Tongue and lip ties are often also brought up either by parents or other health professionals. These, I think, again, are somewhat controversial. If baby has adequate weight gain, then I don't think that really anything is required as long as mom is not having significant discomfort. Where this can become an issue is if you have a baby who's not gaining weight well, or mom is continuously having discomfort that's not improving despite what they feel like is a proper latch, and either Laura or I having observed a feed in the office, then either referral to, say, ENT or the pediatric dentist for possible frenulectomy can be indicated. I have had some infants whose moms and dads have taken them for this and they feel like it makes a significant difference. I've also had the opposite be true, where they feel like they've gotten the lip tie or the tongue tie assessed, taken care of, and then they come back and mom says it really didn't change much of anything. As far as supply, I did touch on this earlier. You hear a lot about undersupply for moms who are not making quite enough milk. And I think there's several things that women can do to increase their milk supply. Most, again, is that adequate nutrition. And then oversupply was something that I had never heard about at all until I was nursing my sons. And I think that this can be very frustrating for moms because they don't know where to turn to. So with an oversupply, sometimes doing what's called block feedings, where you nurse only on one side versus both breasts, can be beneficial. And then moms can either pump that other side or simply wait and hold and try not to express that breast milk so that will, again, as Laura mentioned, supply and demand, that maintenance of supply. If you're demanding less from that breast, then hopefully you will have a decrease in the overall amount that's there. And then from a discomfort perspective, which I'm sure we've all heard about, it comes on with nursing. And we've all heard horror stories, and for some parents, it's exactly the reason why they stop nursing. The nipples that are cracked and bleeding, or the engorgement that's so bad that it makes them feel like everything is rock hard or a major significant difference in production one side versus the other can cause for a lot of issues. And I think if we as providers are able to meet those conversations, talk about how, they're not the only people struggling with this, empower them to know that this will not, hopefully, especially considering engorgement in the nipples, this will not last forever. Yes, sometimes there's always going to be a difference in production, but that's not necessarily a bad thing. That simply results in one side maybe particularly having more mammillary glands than the other, and more production on one side than the other. But just that reassurance to parents that this is okay, this is normal, it's not comfortable for right now, but it will improve if you're able to give it just a little bit more time to get through there. And I think for us, that gives us just a couple of minutes to address any questions. If anyone wanted to put anything in the chat. This just has the information. No, we do not specifically need to wash off lanolin. There are some other products that are out there that do recommend being washed off. I tell parents a lot about, again, not to speak brand or recommend certain, products, but there is specifically a Medela cooling, I forget the way they advertise it, but it's effectively a cooling application that you can put on after nursing, and they specifically recommend that gets washed off. But no, lanolin specifically, I can remember putting lanolin on and then the kid immediately noticing like right after, because I thought he was finished and then he was not. So no, lanolin specifically does not, but there are some other ones out there that do recommend going ahead and washing them off afterwards. Anything else?